This is the injury report presented by NYU Langone Health. When can the Jets expect to get Garrett Wilson back on the field? He's been ruled out for multiple weeks, as you guys know, due to a hyperextended knee that he suffered in the loss at the end of the Broncos game out in London. So in today's injury report, we're talking G5's knee with Dr. Julia Iafrate, who specializes in sports medicine and rehabilitation, as well as orthopedics at NYU Langone Health. Or should I say, welcome back, Dr. Julia Iafrate. What's going on? How are you?
It's been a long time. Good to see you again. Thanks for having me. Excited to talk about this injury.
Okay, let's talk about it. Can we give the JETS Nation a little bit of good news? Because I think things possibly could have been a lot worse than expected. So what happens when a player hyperextends the knee, and how is that different from, I guess, a ligament sprain or even a tear?
Yeah. So it's more of an umbrella term for something that could happen, right? So when you hyperextend the knee, basically, if this is the knee joint, it's bending backwards, not in the direction it's supposed to go by any means. And so when that happens, a lot of things can happen to the knee, both at the front of the knee, where the tissues at the front, which is called a Hoffa's fat pad, that fat pad can actually get impinged, and that hurts just underneath the kneecap. But deeper inside the knee, you can also get an injury to some of the ligaments. It's more of a stretch injury. You can also get bone bruising that happens to the femur, so the upper thigh bone, where it comes and attaches into the knee joint. That can get bruised and cause a lot of pain. There can be some laxity or some, ligamentous stretching, but not necessarily a complete rupture with a hyperextension.
So they're saying that he's going to be out for a couple of weeks. What's the recovery and that rehab process like during that time? Like, how aggressive can he attack the rehab?
Yeah. So the good news is it doesn't sound like there's any acute significant tear to any of the ligaments that are within the knee joint. And inside the joint, there's two main ligaments. There's the ACL and the PCL. They kind of crisscross each other like this. And so one stops the knee from shifting forward. The other one stops the knee from kind of shifting backwards or hyperextending. And so the PCL is the one that I'm most concerned about for him in terms of a stretch injury. The main things that he needs to focus on with rehab, first, we need to get the swelling down. Anytime there's any kind of injury, you bump your elbow, you hit your knee, you twist it, you do anything, there's some swelling, there's inflammation. And that remodeling cascade has to occur. So you get initially inflammation, which takes a couple of days, and then it goes into proliferation, where all these healing growth factors come to the area to try to help it remodel. And then it goes into this remodeling phase where, it could take a couple of weeks before somebody feels good as new. In this situation, he needs to get the swelling down first. That's the ice, the rest, all of those types of things. The bone bruise needs to heal at least somewhat, so that he feels more stable on the knees, so that he doesn't have that feeling of instability. And then, if there is maybe a little partial thickness tear to the PCL, I don't have access to his MRI, so I can't say for sure if there is. But if there is a little bit of injury to that PCL, then the other thing he might want to consider doing is something like a PRP injection, which is platelet-rich plasma, where we take some of your blood, spin it down in a centrifuge, inject it into the damaged tissue to try to really encourage that remodeling phase.
I'm glad you talked about the PRP shot, because that was my next question for you. So that's Garrett Wilson. He's got top trainers at One Jets Drive. They're going to make sure that he is as good as new before he steps back on the field. But what about for our weekend warriors? Does that recovery and rehab process differ for the non-pro athletes? And how would you and the great doctors at NYU Langone treat a patient that doesn't play for the Jets?
That's a great question, and an important one, because we take care of a lot of weekend warriors. We take care of a lot of professional, semi-professional athletes, but I also take care of a lot of kids, right, that are little athletes. I think the important thing here is you have a continuum of options. So in a lot of people, sometimes just rest and some really good physical therapy will do the trick. Okay. Yes, professional athletes have great physical therapists on hand. They have somebody that can pack their ice for them. They have somebody who can time when they get their next medication. They can have somebody do PRP, no problem, no questions asked. More importantly, though, a lot of these options are still available to the regular population as well. So, for example, I do PRP injections very commonly in my practice. Yes, there's an out-of-pocket cost with them, but for some people, it is worth it to them because it can help with the remodeling cascade. Especially, we live in New York City. I mean, people walk everywhere. This is not a place where you can just sit in your car and just be okay with a little bit of a knee injury. So, I think the option to have something like a PRP injection is certainly commonplace, but it's not necessary in a hyperextension injury in most cases. It's just the cherry on top. But the most important part is actually the physical therapy in this situation.
The biggest thing I miss as a pro athlete is when we had people pack your ice for you. It was like, it was my I've arrived moment. Doc, that was great. Thank you for the information. And let's make sure it's not too long again until to have you back.
Deal. I'd love to come back anytime, you know this.